Hello friends, I am Dr. Lal Krishna, second year DNB surgery resident at Tata Motors Hospital. So today we will be staging testicular tumors. Clinical staging of testicular tumors includes tumor, primary tumor, then the nodal status that will include clinical stage 2, and the metastasis that will include the clinical stage 3. And along with that we will have post orchidectomy serum tumor marker status that will also affect the clinical staging. So let's see this in detail. So clinical staging, that is clinical stage 1, when it is confined to testis, and when we see it pathologically, it is T in situ, tumor in situ, that is intratubular germ cell neoplasia, that is TIS. Then it is T1 when it is limited to testis and the epididymis with no lymphovascular invasion. Then T2, it is T1 plus when there is involvement of tunica vaginalis, and it is associated with lymphovascular invasion. Then T3 where there is spermatic cord invasion with or without lymphovascular invasion. Then T4 where there is scrotum invasion plus or minus lymphovascular invasion. Then we have clinical stage 2, that is regional or retroperitoneal nodal spread, and it is the nodal spread we will see. So it is stage 2A when lymph node is less than 2 cm. Then it is N1. Then stage 2B when lymph node is 2 to 5 cm, and it is N2. And clinical stage 2B. And clinical stage 2C is lymph node more than 5 cm and node 3. Then we have clinical stage 3, that is metastasis. It will involve non-regional nodes or distant metastasis. So metastasis M1A is when there is pulmonary metastasis or non-regional nodes, and M1B, that is other distant site metastasis. Then we will see serum tumor marker staging of testicular tumors, and it is based on post radical inguinal orchidectomy serum tumor marker levels and not the levels at the time of diagnosis. So it is S0 when it is within normal limits. Then we have S1, S2 and S3 in which we will see the levels of alpha fetoprotein, beta HCG and LDH. So S1 where the AFP is less than 1000 nanogram per ml plus beta HCG is less than 5000 international units per ml, and LDH is less than 1.5 times upper limit of normal. Likewise in S2 the AFP is between 1000 to 10,000, or the beta HCG is between 5000 to 50,000, and or LDH is between 1.5 to 10 times the upper limit of normal. And in S3 it will be AFP more than 10,000, or beta HCG more than 50,000, or LDH more than 10 times upper limit of normal. So now let's see the staging of these testicular tumors. So stage 1 will be when the primary tumor is 1 to 4 and there is no node, no metastasis, and serum markers are not assessed. Then stage 2 when there is any tumor but the node metastasis has present, and it could be 1, 2, 3, and no metastasis and no. Stage 3 is any tumor, any node but distant metastasis is present and serum markers not assessed. So let's see the staging in further details. When we call it as stage 1A when there is primary tumor is 1, and node is 0, no metastasis, and serum tumor markers are within normal limit. Stage 1B is when primary tumor is 2 to 4, no nodal metastasis, no distant metastasis, and serum markers are within normal limits. And 1S is any tumor size, no nodal metastasis, no distant metastasis, and serum marker are elevated from 1 to 3. Then in stage 2 we have stage 2A, B, C. Stage 2A will be any tumor but N1, distant metastasis 0, and serum marker could be 0 to 1. In stage 2B is any tumor N2, M0, serum tumor marker 0 to 1, and stage 2C will be any tumor N3, no distant metastasis, serum tumor marker 0 to 1. And now we will see stage 3A, in which there is M1A, that is pulmonary metastasis or non-regional lymph node involvement, and serum marker is 0 to 1. In stage 2B it is M1A plus serum tumor marker 2, S2, or it could be any tumor but nodal involvement 1, 2, 3, and no distant metastasis but serum tumor markers 2. And in stage 3 it could be any primary tumor, and it could be variable like any nodal metastasis, could be 1, 2, 3, and in metastasis it could be M1A, M1B or 0, or it could be S3, any or S3. And thank you for watching. Please like, share and subscribe. See you soon with another video. And never give up, because great things take time. Keep going.